So good afternoon, everyone. Thank you for attending this webinar on, I know it's might be late for some people. So I know this webinar is mainly for the refraction certificate exam of the Royal College of Ophthalmology. But we would also like to inform you that we are officially launching our FRCO Part 2 oral examination preparation course in September. So this course, again, it will be on flexible weekends. It won't be on weekdays. So most of you will be able to attend it. And it's flexible. So it's not like a fixed timing. It will be depending on everyone's availability. And all the learning materials will also be available with our database for people who will be subscribing for it. And additionally, this main thing this course is going to offer is sort of a one-on-one mock session, and also we will have a group on Telegram, which will be open for your questions and queries, and it will be answered as and when possible by the team. So any other points, Sweta, you'd like to add about the course?
No, we have like a small group teaching, which we will approach station by station for the Viva and OSCE, telling you the maximum possible questions and how to approach that station. You will get a personalized feedback as to what you have to improve for the exam rather than just a small group teaching. The initial 4 sessions, we have small group teaching. And then the last 2 are one-on-one mock Viva, which you can schedule according to your free time. And this is spread out. So you can attend one weekend and then prepare that particular topic. So you have time to get feedback and prepare. So that's the highlight. Based on how we struggled to prepare, we've come up with this model.
Yes, hopefully a helpful model. So then without much delay, I think we will start with the refraction exam preparation. So I'll share the screen first.
Yes.
All right. Okay. Hopefully that's yes. Okay, so sorry, 1 second. Is my presentation visible, Sweta?
Not yet.
Now? No.
No, it's still a blank screen.
It just shows the 1 second. I'm gonna try that again. Sorry, 1 second, guys. Sorry about that. Is it visible now?
Yes.
Perfect.
Yeah.
All right. So the refraction certificate exam is, I think this is what sets apart the FRC's Glasgow from the FRC ophthalmology exams. So you don't have the refraction part in Glasgow, but here you would need to do the practical refraction part of it. So that's why the Royal College of Ophthalmology stresses very much importance in terms of optics and refraction, both in theory and in practicals. From my perspective, I found this exam to be one of the easiest exams because even in our residency, refraction was part of our curriculum, and most of us who did our masters elsewhere will know that we do have to do practical refraction for patients, retinoscopy for patients almost in everyday practice. So if not, the only glitch would be to get yourself into the groove in terms of the practical aspect of it, but beyond that, it's more of repetition rather than having to learn too much and in a short period of time. It's a single thing, more in repetition, and the more you do, the quicker you're going to get, the more confident you're going to get, and it's much easy to crack this exam. So what to expect is it's a 10 OSCE station, basically 5 rooms, and in each room it's 2 OSCEs. So now it's a hybrid exam. When I did the exam, I was the last batch in terms of complete model eye. We did not have any patients at all. But now they're coming back to a mix of both model eye as well as patients. So 2 rooms, which is 4 OSCE stations, is basically just model eyes. So model eyes will be set and there will be a fake mask over it. You just have to do your retinoscopy over it and input the findings. That's it. In the 3rd room, it's a patient with non-cycloplegic retinoscopy. That basically means that they will not be dilated. So you will have to learn to do refraction with patients without them accommodating. So I think that would be the tricky bit. But even that, in the initial stages, you could do with the model eye, because you can change the size of the pupil in the model eye to a big or a small one. But still, you should start doing it on patients or colleagues, whoever's willing to offer you support. Then the room 4 and 5 is a bit of a tricky one that I would leave to Sweta, because when she did the exams, she had those, which is again with patients, and it is peer refinement and cylinder refinement, and binocular balance. And forcimeter, again, it's been there for a long time. It's again one of the easier ones. So once you know how to do it, you will kind of get through that. So each OSCE is for 15 marks, and it's a total of 10, so 150 marks. And the marking pattern is also very clear. You won't have any confusion with regarding to that. So before we go, I just did a small video in terms of how to go about with this exam, because it's not in a return format. It's going to be an iPad in which you have to input the data. So the iPad demo version is available in the Royal College website. If you just go to the same page where we have all the details about the examinations, and you check into the refraction certificate, it has the details about everything, the same thing that we spoke about: how many stations, where you can find the video tutorial, what's this hybrid pack for the examination, like number of cases, number of model eyes. Make sure you have a look at the tutorial. I know I'm offering a small one now, but just in case you want to go back and have a look at it again. And when you go to the end of the page, it has a demo version. Once you go into that, just go click the refraction button on top, and then you can just start practicing. So here again, it shows what is station 1, what station 2, 3, 4, and 5. So the first 3 stations, more or less, the entry methodology is the same. 4 on 5, it's a bit different, because as I mentioned, it's about refining the sphere and the cylinder, and you just need to input the data accordingly. I'm just going to show a small example for station 1 on when you open the page, what it is you're going to expect. So it's main thing you need to remember is the timer here. It's going to be there in your exam as well, and it will start the moment you enter the page here. It won't be like this. So here it will start once you start giving the answer, but in your real exam, the moment you open this page, the timer will start. So it's 10 minutes for both eyes together. So we need to be as quick as possible, as organized as possible, and as thorough as possible. So here you can see that for the first section, it's 12 marks. And then for the second section, 1 mark, and the final section, 2 marks. So remember about the importance of weightage of marks. So first section is basically you do your retinoscopy, you neutralize the value, and then you either can put it in a cross, or if you're well versed in the spherocylindrical format, you can put it in the spherocylindrical format. I prefer the cross because that is how I have been trained. So first thing is, it will never be a 90-180, and it will never be a spherical power. So it's always an oblique one. So make sure you are able to identify the axis, and that's it. It's very easy to input the data. It's not very complex at all. So once you input the cross data, you just complete this section of the answer sheet, and you save and continue. So the next section is quite simple. It's just the distance correction. So for me, it's 67 centimeters. And if someone has a longer arm, it could be 100 centimeters. Only thing you need to remember is make sure you put the proper dioptric equivalent, because it's an easy 1 mark which you can get. We don't want you to lose that. And following which is the final prescription power. You can prescribe it either in a positive plus cylinder or a minus cylinder. Either way, it doesn't matter, as long as you get the value right. So that is all that you need to do in terms of the iPad version. But we do not usually do this. We all have our pen and paper in which we quickly write it down. So practice always with the iPad demo version, and do not let it be till the last minute that you open the iPad and see how things are done. So this is basically for the first 3 stations, which I will be covering. So first thing you need to remember is retinoscopy will be provided at the centers, but I know for a fact there are various models available, and sometimes you would have learned in a particular model which will not be there at the center, and that can throw you off during the examination. So if possible, bring your own retinoscope, and a well-charged one, or with replaceable batteries or whatever that is required. But if not, do not fret. It will always be available at the examination center. And this is the model eye which they use, the Heinz model eye. Another trick I would suggest is most of your trainees or people who have completed the refraction exam should have this model eye with them. They usually sell it as a second hand in Telegram if you're able to find them. That's how I got mine. So if possible, get the model eye and practice on it as many times as possible. And so this is the model eye they'll be keeping. And if you can see, it has the axis on it, but in the exam, the model eye will be hidden behind a face mask, so you won't be able to see the axis. And for the first two rooms, you won't have a trial frame to check for the axis. So say it's not a 90 or a 180, and then you're not sure what exactly the axis is. Just behind the head of the model eye, there is a protractor stuck on the screen the similar way. And this protractor, you just need to shine the retinoscopy light exactly as you did back onto the protractor, and that will show you the exact axis in which the cylinder is located, and then you can input the data. So many people were not aware of that. So just check the room once you go in. You will have 5 minutes time to assess the room, the lighting in the room, the instruments, the tray, everything. See if the protractor's picture is on, because otherwise you can just tell your examiner and sort it out. So the other thing which I learned from one of my mentors, like she was like, these are the things you need to do to save even every second of time. So what I used to do is, once I have that, the lens trace set up, I usually sort of flipped the number one power, two diopters, 3, 4, 5, 6 to the other side. So I know what interval we are standing at. And I know, okay, if I pick that lens, it's a 1.5. If I pick that, it's 1.75. So it's much quicker for your brain to kind of understand where you're at. And also make sure every time you pick up a lens from the tray to do the neutralization, put it back in the same spot. Many people have lost time because for the second eye, they're not able to find the lenses, the right power lenses, and they're searching for that. And that is how they've not been able to complete the station. It might seem like a very simple thing, but when it's a cumulative aspect, when the end of the station, you will feel the pressure to input the data. So, so any trick, something like this, whichever comes to your mind, you can use it to help with your examination. And then another aspect is you will be given a pencil and a piece of paper. So you can write down your cross or your value, your calculations, everything in that first before inputting the data onto the iPad. I did not touch my iPad till I finished the refraction for both eyes and wrote it down on the paper, and only then did I put the data on the iPad. So even for identifying the cross, so once I got one axis, sometimes by when we I know in a hurry, lack of sleep, anxiousness, we might calculate it the wrong way and it gets a bit confusing. So what I did was identifying one axis, I put that into the axis sheet on the iPad. It automatically gives you the other axis, so you don't even need to sit and calculate. So then you draw the cross, identify the axis, the first thing that you need to do, and then you neutralize it. So neutralize one axis first and then neutralize the other one, input the data there, do the distance correction as a cross or as a spiro cylinder, whichever is comfortable for you. As I told you, my method of doing is via the cross, so that's how I prefer to do it. But if you prefer to do it any other way, go ahead. And I also made sure I did the final prescription on the sheet of paper before I went on and put all the data in the iPad. So this way, the room for error is almost nil. But rather, if you just keep it in your mind and try to enter it directly into the iPad, you might end up putting the wrong number there, and you won't even have anything to go back to check later on. So that is where many people lose out on marks. And also the other thing is they do everything, they get everything done, but they're a bit slow and they do not have time to enter into the iPad. And that's another major issue that we have to get over in terms of practice. So I'm pretty sure everyone who started their preparation for the refraction exam will know about this simulator. It's available in the AAO website. It's a simple simulator. It's not going to be of much help in terms of advanced preparation, but to start off with, say you've never done retinoscopy, you don't know what the reflex looks like or what a with movement or an away movement is. So this simulator will help you with that. So this is the streak. Normally when you hold it in front of the eye, this is how you're going to move it left and right. So now we can see there's no movement, but the moment the power of the eye changes, you can see a reflex there, and that reflex is moving along with the streak. So that basically means that the eye is hypermetropic. So you can see that depending on the power of the eye, the reflex color, the width, the speed in which it moves, the definition, everything changes. And the moment you put a lens of power which is of the same towards the neutralization, the reflex becomes more brighter, more smaller, and moves more faster. So these are some of the tricks that you will identify as you start doing retinoscopy. So another thing is in the aspect of learning, small tricks. So some powers might not be 2 or 3, it might be 5, 6, or even the higher ends of myope or hypermetrope. In that case, it's going to be a gray reflex. You're not going to see anything. It's going to be very dull, very slow. You won't know if it's with or against. Just take a high powered lens, could be +3, +4, just put it in front of the eye. Don't start with 0.5, 1, 1.5, 2. It's too much waste of time. So just take a -3 or a +3 and put it in front of the eye. It's immediately going to give a drastic change in the reflex, which will help you identify where you're standing at. And again, in terms of finding the axis, once you realize that the patient's eye has some axis, it doesn't align with your streak, it will be very obvious in terms of the movement. So automatically you need to rotate the streak in your retinoscopy to identify in which axis it's more or less close to. So that's the simple trick. So once you identify the axis, make sure you neutralize that first, and then immediately flip the axis to the opposite side and neutralize the other one.
Shruti, your screen is stuck. If you're still going on, we're actually not able to hear you. She's just joining back in a couple of minutes. Sorry about that, guys. Can't hear.
Oh, can you hear me now?
Yes, yes.
So
Go on.
can you just let me know which slide I stopped?
It was just at the end of this simulator when you were saying we have to neutralize the opposite
simulator?
angle.
Yes.
Yes. So in that, the last part, when you were saying
Yes. Okay.
once oblique axis is done, the opposite
Mm.
angle needs to be neutralized.
Perfect. All right. Sorry about that. Some error with the network. So, anyways, as I was telling,
That's stuck again.
the oblique axis, your patients, but more or less in terms of what you need to do, it's the same for the model eye and the patient. So, if you can't get enough patients to practice as much as possible with the model eye, with the iPad, not on a piece of paper. So the take home message is, as we covering up with everything, time management is very just have 10 minutes for 2 stations. So try to make sure you're aware of what's happening. The moment the examiner says start, it's going to start. The timer is going to start on your iPad. So have a look at that. Make sure that you are running out of time before you can input the details into. Use all tools at your disposal. You will have 5 minutes in between stations to check your room, the lighting and everything. So make sure if anything is amiss, talk to the examiner and make sure that all is sorted out before they start the exam. Use the piece of paper and pencil because error can be avoided, and human error is always possible, especially with a high stress situation. So do not skip steps trying to, just finish it in one go. Be more organized. The lens tray is one of the most disorganized things that can go haywire. So make sure every time you put it back in. Keep a check of all the lenses that's been arranged. Even when before you start, sometimes your previous candidate could have jumbled it up. So make sure you put it back all in the place before you start your examination. Double check your input. Even once you have done both eyes, go back to the piece of paper, check that you have put it all in the respective manner, and make sure the distance correction that you're providing is the right one. It's a very simple thing, but we can make an error in that. And adequate practice. So once you reach the point where you are able to enter the data in the iPad within the time given, that I think is the point of adequate practice. So other than that, I think for the first three stations, this should be more than enough. If there's anything, any other questions, do not hesitate to ask me. Thank you.
I think we have,
Yes.
yes, Manasi, go
Hi.
on.
Hello, ma'am. Thank you for the talk. Ma'am, I actually wanted to ask you two things. The first thing is you said that in our non-cycloplegic patient, we should try to make sure that the patient does not accommodate. So do you have any tips that we could use to like achieve that?
It's very simple. Make sure they are fixating on a distance target. It will be obvious even when you're doing the retinoscopy on them. When if they accommodate, immediately you will notice that the pupil shrinks. But the moment they're fixating behind you and they're not looking at you, the pupils will actually be a bit more dilated, and it makes it easier for you to get the streak value as well. I know it's a bit difficult in terms of, you will be also have to stand in front of the patient, and it's difficult without obscuring their view for the distance. But so that is where they say it's like the direct ophthalmoscope. Try to use your right hand and your right eye for their right eye, and your left hand and your left eye for their left eye. But if not possible, well within your discretion to use the but that's a trick, because as long as one eye is free for them to fixate in the distance, it shouldn't be a problem.
Okay, ma'am, would you recommend using a occluder or fogging the other eye?
You mean for non-cycloplegic refraction?
Yeah, if the patient is not looking at a distant object, could we do it? Like, could we just occlude the eye to prevent accommodation?
Like they prevent accommodation. You're telling about the other eye in the sense?
Yeah, the other eye. So if I'm neutralizing one eye, the other eye.
Yeah, so if you occlude the
Mhm.
other eye or fog the other eye, then they will have no point to fixate. So you will be refracting the right eye and you have occluded the left eye. They will accommodate more with the right eye. They will still start to look at the light, and the pupil will go down, making it more difficult for you to do the refraction. So from personal experience and my practice, I recommend that if you're doing the right eye, use your right hand and your right eye to the patient's right eye. Leave the left eye open and give a distant target.
Okay, thank you, ma'am.
And one other thing they say is some of them try to use their distance correction, like for 67 centimeters, if you're using the 1.5, they already put it on the trial frame and put it on the patient's eye. So you put a plus 1.5 there, it kind of prevents them from accommodating if they're a myope. Kind of helps if they're myope, but doesn't work your way if they're hypermetrop.
Okay. And ma'am, my
I mean,
second question.
from personal experience, I don't think fogging is needed. No,
Yes.
it wouldn't really matter.
Don't.
No. Mm-mm.
Yeah.
Sorry, go ahead.
Thank you, ma'am. And ma'am,
And
my second question. Can you explain the way you'd approach neutralizing the eye? Like, because I've seen videos in which they recommend that you should always try to get like a with reflex and then you work your way backwards. Do you follow that or?
Like in the sense, overshoot the neutralization and then work your way backwards, something like that?
No, so you start like it doesn't matter whether it's a myopic eye or a hypermetropic eye. You always first get a with reflex, and then you decide how you want to go about it.
Not needed actually, because if you immediately you're doing the reflex and it's a against reflex, why would you want to make it a with? You know it's a negative one, so you can just go ahead and neutralize what exactly you're seeing. But as I said, there are extreme cases with a high myope and a high hypermetrope. You don't really know what reflex you're seeing. Same way, if it's very close to neutralization, like plus or minus, you still, again, you won't see much of a reflex. In those cases, yes, you can try to put whatever power you can to see what exactly your reflex you're getting out of it, and then take it from there. But otherwise, whatever you see, try to neutralize that. No point in making it with and then coming back.
Okay.
That's my experience. Sweta, you have any other answer to that?
I agree, because you have very little time. It's 5 minutes per eye for you to write it down in a paper and then enter in the iPad, which means you have to get your end prescription in 3.5 minutes per eye, giving you enough time to enter into the iPad. So in 3.5 minutes, you don't have time to think whether it's against reflex, with the reflex, should I overshoot and bring it? No. Go look at the reflex, with moment, against moment, start neutralizing, get the answer, and enter into the iPad. That will be your approach. Keep it very, very simple as possible.
Okay, thank you, ma'am.
Okay.
But I
So,
think one advantage with this exam is that no matter, even if you go plus or minus a few degrees, or even in terms of power, it doesn't need to be exact power. They do give you a leeway either side. So don't stress too much about.
yeah, you don't have to be exactly accurate. Point up to 0.5
You say
diopters
it's a
this
3
way,
and you
that
say
way.
it's a 3.25, are they going to say, they're not? So
Up to 0.5 diopters, I think you're still given marks. And 5 degrees this way, that way you're given the full marks. So 5 degrees, 10 degrees, or 0.5 diopters, you don't have to really. So if it's a refraction of minus 0.5 and you write it as 0, it's fine. You still get the marks.
And ma'am, would you recommend using a lens rack?
a lens rack for
Or retinoscopy? Like nowadays, a lot of people are recommending like picking up a single lens. It takes a lot of time. So instead of that, there's a lens rack, which would
Oh, you
save
meant
time.
the flippers, the entire powers on the same
Yeah.
piece of ruler. Okay, I've never used that personally, or I've always used the loose lenses. So I don't think I can answer that. Sweta, what about your experience?
No, I've also never used that, and I'm not sure in the exam what they provide. So it's better to practice with the standard equipment that they provide, so you're not thrown away or thrown off balance in the exam hall.
Okay, thank you.
And each place
No.
they organize, you have to actually go into the room, assess the room. Sometimes the lens tray is kept on the side, sometimes behind. If it's a very narrow passageway, the iPad is on one corner, the lens tray is in one corner, and the model eye is in one area. So assess that quickly. You're allowed to rearrange to your convenience in the initial 5 minutes of preparatory time. So quickly take it, keep it in the way that you're used to doing, or you've practiced. Use the piece of paper and then go to your iPad. Make sure you're close to the iPad. Check the alarm bell if you're able to hear it. Sometimes it's the end of the room and you're so busy doing everything, you don't hear the bell at all, because you get a warning bell at 1 minute and then you have 1 minute of time. So there are 2 bells. So make sure that you check the room for all this. That's something very important.
And I think the other point I would like to add is the model eyes will be kept on a examination chair, which is very high. For short people, if you're sitting on the chair and trying to do retinoscopy, it's not going to work. So I just stood for the entire exam and it was very quick. Same way as Sweta was telling, I took the lens tray and placed it on the chair, like the model eye is here. I placed it right there in front of me so that I could just like do like that, not to the side. There's no patient. It's not going to make much of a difference. So whichever is comfortable for you guys, every second counts.
Yeah, so you're not marked on the methodology or anything. the examiner is not watching what you do. They're just timing you in all these objective refraction stations, like station 1, 2, 3. They're just seeing what you do. It doesn't matter how you do it. Just get the answer. So do it, change the room to your comfort and make sure you're most comfortable, because these 3 stations are where you score the
most. Yeah. Mm.
If we don't have any more questions regarding the first 3 stations, I think I'll show the last 2 stations.
I think those are the bit more complex ones. So.
Okay, so we'll move on to the subjective refraction stations. So Shruti has covered room 1, 2, 3, where you have 2 eyes each. 3 would be the first patient station which you encounter, where you're doing non-cycloplegic refraction, meaning in an undilated pupil. So room 4 and 5, which is 4 stations altogether, 10 minutes each. It does not mean that you go only in that order. It depends on where you start. In your cohort, you'll be a batch of 5, and usually you're arranged in alphabetical order. So people like me who are in SW, I started with the last station and then it goes in a circle. So that's how it is. Be prepared for where you start. Doesn't matter where you start. So always be prepared for that particular station. So station 7 or room 4, where we start, it will be subjective refraction, where you're supposed to correct the cylinder or refine the cylinder. Only one eye needs to be refined, and you need to use the Jackson's cross cylinder. They will give you the information. The information slip will contain whether it is the right eye or left eye, and a prescription will be given. So one eye, first station will be 5 minutes. Before the time starts, you can load the unrefined refraction on the trial frame and be ready. In this station, it is most important to fog the other eye. And remember to be ready to alter the sphere with result to changes in the cylindrical power. So even if it's only refining the cylinder, by concept, if you change the cylindrical number by 0.5 or more, you need to be ready to alter the sphere. Don't forget, that's another last mark where you need to go. So this Jackson's cross cylinder, conceptually, I know everybody will be aware. It's an equal cylinder of opposite sign at 90 degrees to each other. For this exam, you can carry your own Jackson's cross cylinder. It is allowed, because the reason I'm bringing this point up is there are different color codes. Like some use red and black, sometimes it's red and white, sometimes it's red and green. And majority of places we use like the red marking as the negative cylinder. But to be honest, in my exam, when I walked in, they said red is positive, do it accordingly. So to avoid all this confusion, you can take your own Jackson's cross cylinder in which you have practiced. In India, I think it's 100, 200 rupees. You get the Jackson's cross cylinder. If you're from the UK, I think it's 10 pounds, so you can just take it from your trust. And even in India, you can borrow it from your optometrist and just return it after the exam. So whatever you're practicing, make sure to know the color code properly and use that cylinder correctly, or be ready to know the concept of positive cylinder, negative cylinder, and be ready to just quickly change according to the color they tell you in the exam. My examiner was nice. She told me in advance. Sometimes they don't do that, so be ready for whatever it is. So this is the most standard Jackson's cross cylinder. They will give you both. They do provide you one. So they will give you both minus 0.25 and plus 0.25. So once you've loaded the unrefined prescription onto the trial lenses, you have to check the visual acuity. So you fogged or occluded the other eye. And suppose you're doing the right eye, you will check the visual acuity. And if the visual acuity is above 6.9, if it's 67.566, then you start with a 0.25, because the eye is quite sensitive to that amount of change. But if the visual acuity is 612 and you start with a 0.25, you might not get results. So start with 0.5. So that is very important there. I will quickly show you a demonstration of what steps is to be done and how. So say they've given you a refraction. If this is the unrefined refraction that they've given you, -2 at 180, they've not given you anything else. Then first thing, occlude the other eye. Insert the cylinder lens of -2 at 180, exactly how they've asked you to do. Then you take the Jackson's cross cylinder. Like the cross cylinder that I described, you have this negative, a positive, which is at 90 degrees to each other, and the handle will be at 45 degrees to either lens. So for first, to refine the axis, you will place the handle, which is parallel to the cylindrical axis. So we said the cylinder's axis given was 180, so you place the handle at 180. Then you flip. You ask whether that side is better, or you just rotate it. When you see here, the red marking is here, and when you just flip it, the red marking goes here and the green marking comes here, but still the handle is at 180. So you ask them whether side 1 is better or side 2 is better, and you wait for the answer. So now they're telling you this side is better. So you see the orientation, this side is better. Then you rotate the trial frame's axis, this lens's axis, towards the red line. So here is the red line. I've done the marking here. So here is the red line, and this is your cylinder's axis. You move it towards it, which means you move it to, from 180, you move it to 10 degrees. Now you got the new axis. Then again, you place that here parallel to this axis. So you place the Jackson's cross cylinder at 10 degrees, and then you ask, is side 1 better? Or flip it and ask if side 2 is better. This time they're telling this is better, which means it's opposite to what they told the first time. So you know that that is the reversal point, which means the axis is between the first point that you started and the second point where they're saying the other side is better. So you have to go in the reverse direction again towards the red line. Now you can go by 5 degrees because you've come only by 10 degrees and already you've achieved the point of reversal, which means you just have to move 5 degrees. You will understand this better once you do this 2-3 times on a patient. Somebody of a known cylinder, if you do it, it is quite easy. The first time when you read this or listen to somebody explain to you, it's going to go above your head. It did for me as well. But carefully go through this step by step and then just follow the steps and do it on a couple of patients. It is very easy to get marks. So now I've gone 5 degrees towards this. That will be the new cylinder. So I've changed the trial lens to 5 degrees. Then again, I place the Jackson's cross cylinder, now aligned at 5 degrees. And then I ask which is better. They say it's equally blurred or I don't see much difference. That is the end point. So you get the final refined astigmatic axis at -2 at 5 degrees. So step 1 is refining the axis that you've done. Step 2 is refining the power. So once you've done, you will place the Jackson's cross cylinder now with the trial frame where the axis of the cross cylinder is parallel to the cylinder's axis. So now I place this. So the minus lens is at 90 degree and the plus lens is at 180 degree or 5 degrees, what we've tried to correct. And now I will ask if side 1 is better or flip it and ask if side 2 is better. So now if they say that this side is slightly better, I will see what side it is. And then accordingly, I will increase the power. So now it is the minus side which the patient is telling is slightly better. So I'm going to add a -0.5 of cylinder. So the power will be, final refraction will be when they say that either side is blurred or either side, it doesn't make a difference for me. Usually it is blurred. That is what the examiner expects. So now the final astigmatic power that you will enter in your answer sheet will be -2.5 at 5 degrees. So in this particular example, there was no sphere given, so it doesn't matter. You don't have to change anything. The last step, suppose they had given you a prescription of a -1 diopter sphere with a 0.25 cylinder at 90, but you've refined the cylindrical value and you've increased the cylindrical value by 0.5 in the cylinder, then you have to change the sphere. So you always add plus 0.25 to the sphere. So if the negativity of the cylinder goes up, you decrease the negativity in the sphere. You need to get that concept straight. So step 1, 2, 3. Each step has to be carried out for JCC. And remember, you have to get to this end point in 3.5 minutes on your paper. So you have enough time to enter into the iPad. So few things that I can offer for you to score high marks, even if this is very confusing, would be to go through these steps. You make sure that the triable lenses are mounted correctly. Make sure that the other eye is occluded. Select an appropriate target, whether you give a O or C, you give a rounded number or a numeral there for the patient to target at. When you ask the questions, is this clearer, blurred, sharper? So what words you use is important. Have you checked the axis first? Have you rechecked the power after you refined the axis? Like, did you check the visual acuity of that patient? Whether you selected the appropriate cross cylinder, depending on the visual acuity. Initially, I told you if it's 612, there's no point in giving a 0.25. You have to start with a 0.5. And have you done appropriate bracketing? Have you just crossed over and then brought it down? Did you use the correct language? Did you record the visual acuity? Because in these stations, you have to record the visual acuity on logmar. So quickly knowing the logmar is important. Second, if it's just remember the logmar for 66, 65, 67.5. Maximum, these are the three values that you're going to use. So know the logmar value. Just entering the logmar value for this will earn you one more mark. So each of these steps contains mark. So even if you don't get the accurate result, and you've gone through all these steps in an order, and you've done it in a very methodical way, not showing or demonstrating that you're flustered, just doing it confidently. Is this better? Is that not better? And just go on, you will still pass that station. That is the whole point of this slide. You don't have to be extraordinary in Jackson's cross cylinder. Just know the methodology, go step by step, refining the axis, refining the power, adding the cylinder. Make sure you're asking the right words and entering it right. That's all. So the trick I would tell you for practicing this is when you register, you get instructions for the candidate, a booklet that is given to you, where you have a model answer as to how each step is marked. Go through it again and again. So it comes as second nature to you in that particular station. So you know, as soon as you go, you mount it, you refine the axis, refine the power, and then alter the sphere. So just keep telling yourself what you need to do. Make sure to give the correct target, occlude the other eye. So certain things, if you do, you get the marks right away. So in this same room is where you have the forcemeter also. So in the initial stations where it is a model eye, it is okay to finish both the eyes and enter. In this particular room, it will be far away from each other. The iPad might sometimes be in the far end or in between. So there is high chance you might run out of time. So make sure to enter after each station. You don't want to lose a 30 whole marks because it's 15 marks per station. So if you finish JCC first, enter it, and then go to the forcemeter. The forcemeter or the manual lensometer used interchangeably is one of the stations where you can just get the whole 15 marks easily if you just practice enough. Get comfortable with that. Focus the eyepiece. Sometimes if it's not your first station, and it's your second or third, you get really lucky because it's already in a very fixed state. You don't have to adjust much. You go and mount the spectacle and you will be able to see the answer. So once you load it, loading just takes 2-3 glasses to just insert and practice. It's not rocket science. It's very easy. And it doesn't sit any other way. You just have to position the spectacle frame so the front of the glass is facing you. So it's like you holding your glass like this. This will be the way you mount it on the lensometer. So it can be a pure sphere or it can be a spherocylinder. Usually, and you have to check both distance and near. And one of the lenses, they say it's usually the left eye, but don't be misled by it. But one of the lenses will have a prism. So I'll tell you certain shortcuts to cut the time here. Once you've positioned, proceed right eye, left eye. First do distance and do near for only one eye. Most of the times it's the same in both eyes. You don't have to waste your time during the near add for the other eye. And to check the near add, you just have to subtract what you found for the distance and what you find for the near. So if suppose you get distance as 3 diopter sphere and near shows 5.5, you know the near add is 2.5. You just can enter it in both the eyes, and checking only one meridian, even if it's a spherocylinder, is enough, because near add, again, you will be adding for both the meridians. These are small tricks where you can save lots of time and have enough time to enter. Just to show you, when you actually focus your spectacle on the lensometer, these are the kind of lines that you see, and these are the circles that you have. So you have like the inner circle, which is 1 diopter, and then outer middle circle, and then the outer circle. If it's only a spherical lens, you will have all these lines focused in a single go. If you have a sphere and a cylinder, only one of the set of lines will be clear when you focus for one reading. So whichever you focus first, you get the smaller number, you can take it as the sphere, and then you rotate the drum again, and the second set, this set which is blurry now, will become clear. That is your second reading. So you have 2 sets of readings now, and from that, if reading 1 is plus 3 diopters at 90 and reading 2 is plus 2 diopters at 180, then the lens's power is plus 3 and difference between these two minus 1 at 180. So remember, you do B. If this is A and this is B, remember it's B minus A at B. It is somewhat opposite to what you write on the cross. So be very, very clear of how you're going to do it. And usually they tend to take the least positive number or least negative number. Each of them have the same, but it does not matter. You can give it in any way. You just need to get this reading there. Either thing could be the first reading. Either thing could be the spherical power that you want to give. You will not be marked down on that. It can be given interchangeably also. The second thing is how to get the prism right. To be very honest, I did not, for my exam, bother about this because I knew the prism was 1 mark or maximum of 2 marks. So I just skipped it to save time because I was not able to figure out in the high stress situation. I thought 13 marks in this is enough. But if you're very keen, you just have to see where this middle point is displaced from the center of this. So it is displaced down. So it is a base down, and where the circle is. So this is just at 1 diopter circle. So you have to write it as base down 1 diopter. If this is somewhere between here and here, you can write it as 2 diopters. This is 3 diopters. If it's between 1 and 2, you go for 1.5. So that is how you have to calculate based on the circles and the direction. So this I've told for base down, horizontal. If you want to look at a vertical prism, so it's displaced from here to this side. So here it matters which lens it is. If this is the left eye that is looking at you, then it would be base in by 1.5 diopters. If it's the right eye that is looking at you, then this would be like a base out by 1.5 diopters. So this is the simplest and easiest way to look at prism. If it's too confusing, if you're too stressed out, do not waste time. Just skip the prism and enter whatever you've got for near, distance and near. That itself will get you a pass mark in that station. I'm not encouraging you to leave the prism out, but I'm just telling, don't take on the added stress if it's too confusing and if you're running out of time. Again, remember, you have to do right eye, left eye, both eyes distance and near, and have to enter into the iPad, which means you have to get it done in 3.5 minutes and enter. So like I said, do the distance in both eyes, do near in one eye. If possible, get the prism or just chuck it. That's the easiest way to get out of this station. And each lensometer or forcemeter, the reticle, when you focus, might look different. Some of the things look like this, with a protractor there to get you the axis. Some of the machines look like this, where there is an inferior display within your observer scope, where you can see the power readings here, it would come. And some of the lensometers focus like a cylindrical cone with the lines in that, and then you have to figure out the axis again, which is present on the outer side of the lensometer. So each lensometer or forcemeter is different. Don't fret. 2 hours before the morning session, the forcemeter for that set of examination is kept outside the exam hall for familiarizing yourself with the machine. I was not aware of this till someone who went before me told me. In fact, it was Shruti who guided me that this will be available. I know not all of us have been exposed to this forcimeter or lensometer. Some of us could not find a manual forcimeter because everybody is shifted towards automated. So if you have any difficulty, just watch videos of how it is done. Go 2 hours before the morning session starts. There is a person and this lensometer kept there. Everybody will be practicing. You can take 2-3 spectacle powers with you, your friends or from your family. Quickly mount it and practice. So that is one trick which you need to be aware of, and it is possible to easily score marks. The last subjective refraction station is room 5, station 9 and 10. This is one of the easiest subjective refraction stations. And this is one thing, together is 30 marks, 15 for each, but it's a double OSCE. You have 2 answer sheets, remember to fill both, but the patient will be a single patient. Okay, it's 1 patient, 2 eyes to be done, and it's a double OSCE. So the first OSCE is you have to refine the sphere. They will just give you a dummy prescription. Like, for example, they'll give you minus 2.5 in the right eye and minus 2.25 in the left eye. So you have to just mount the lenses on the trial frame and check their refractive, check the visual acuity in each eye, and then refine the sphere. That is OSCE 1. OSCE 2 is further refinement or muscle balance, which means you have to see binocular balance. That is OSCE 2. So there are multiple methods to do this, but the Royal College recommendation and my personal recommendation, because it's easy and methodical and you can't go wrong, is modified Humphreys and duochrome, which is done together. I will quickly take you through this. So remember, refining sphere total of 10 minutes, which means it's 2 OSCEs for 30 marks. And you must not alter the cylinder here, just sphere, don't touch the cylinder. Mount the given unrefined prescription before the time starts. Again, just like JCC, you can mount it before the time starts. And just like JCC, always fog or occlude the other eye. When refining, because it's important, the other eye is not focusing on the same thing that you want the eye that you're working on to focus. So you can either fog or occlude, but to be on the safer side, just occlude so the examiner is able to see what you're doing. Here, you're not talking to the examiner. You don't have to explain yourself to the examiner, and they will not question you, but they will be watching what you do and marking step by step. It's an OSCE. They just see, have you mounted the trial frame? Then they give you 1 mark. Have you fogged the other eye? Then it is 1 mark. So that's what they're doing. So what you do needs to be like an act. You just can't hide everything and do in a very unorganized way, then you will lose out marks. It needs to be like an act, showing the examiner what you're doing, and do it in a very deliberate, dramatic way, but be quick. So occlude the other eye and says, do you not able to see through this eye, right? So the examiner knows that you have occluded. So be very quick, but be deliberate to make sure that you've done the steps. You have to check the visual acuity in each eye. The most important here is first you offer a plus lens. Start with a plus 0.25. That would be my recommendation. Again, depends on the visual acuity. If it's 6.6, 6.7.5, then a plus 0.25 will show a big change and they will be able to answer. If it's 6.9 to 6.18, use 0.5. Worse than 6.18, you have to use 1 diopter. You will not get patients worse than 6.18. 6.9 is maximum they give you in the exam. It's quite simple. They don't trick you badly. So start with a plus 0.25. And if they accept it, keep offering more plus. If they don't accept, then offer minus. The endpoint will be when you offer a plus 0.25 and they say, I can't see much of a difference, it's about the same. That is where the endpoint for refining the sphere is. You go right eye first, left eye next, and then you enter it right away. That is OSCE 1. It's quite quick. You can finish it together. And then when you ask the question, make sure, just don't ask, is it clearer? Is it better? Better, is this better, or side 1 better, side 2 better? Those are the words that you use for JCC. Here, ask if it's clearer or just smaller and blacker. These are the key words that I've written in red that you get the mark. If you don't use these 3 words, you're marked down by 1 mark there. When you move on to OSCE 2, which is for binocular balancing, we use this method called Modified Humphreys Immediate Contrast Test, or HICS. This is the method what the Royal College recommends. So say you're testing the right eye, then you put a +1 diopter lens on the left eye. That is fogging. Then in the right eye, you first offer +0.25, and then you ask whether it blurs or not. If it's not blurring, then you increase it by steps of +0.25. You might come and ask me, isn't the same thing that we did before? Yes, it is the same thing, but this is for binocular balance. There you occluded one eye, here you fogged one eye. That is the difference. It is almost the same, but you need to do it twice to get marks. Otherwise, you end up losing it. Then you repeat the same for the other eye. This is done. And in addition to this, you have to do a duochrome test. That is when you're showing the examiner that you're balancing both eyes. Make sure to dim the lights for duochrome test. Make sure to use the right chart. And here, remember, both spherical power and cylindrical power are mounted. You don't have to change anything that you've already done. And make sure your concepts are right for duochrome test. If it's a myope, if your prescription given to you is about -2.5 or -3, make sure they say it's equal in red or green, or it's better in red. Do not leave them in better in green. That is an error, and that might be one of the red flags where you can fail that station. It's not that 1 or 2 marks that you're losing. These are the major points where you can lose the station, because that is a grave error in when you're doing the refraction certificate. So myope, make sure to leave equally good in red and green, or better in red. For a hyperope, if your prescription is +3 or +2.5, then make sure you leave equal in red and green. Suppose you mount the prescription and the patient says green is clearer. If green is clearer, offer plus. Remember, green positive, you offer a plus. If red is clearer, offer a -0.25, and do this till both appear equally clear. Be very, very clear in this concept. There are multiple YouTube videos on duochrome test, and be very confident when you do this and have enough practice on your colleagues. Find and do it on all your friends to make sure that you're thorough in this concept. Again, the scoring points here would be if you've mounted the lenses correctly, have you tested the visual acuity, did you fog the fellow eye, did you get them to read the last line and ask them to fixate on a particular letter, not offer a 660 and then do the correction. Don't do such small errors. We will be stressed, and we tend to do such silly mistakes in the exam. So these are the things that they check. Did you offer the plus lens first or the minus lens first is something the examiner sees. So when you're offering, make it very deliberate. This is a +0.25. Can you tell me if you find a difference? You can be vocal. It is not compulsory, but being vocal, you will not be marked down. So if you want to be sure of these 1 marks, you can be vocal and be very clear in what you talk to the patient. And you have to ask the correct language. Is it clearer with this or without, or is it same? Be articulate in what you ask. Don't be very feeble that the examiner is not able to hear you, because they will not bother to ask you again, or what did you say? No, they will just mark you down. They're only observing. They are not going to talk to you. Then avoid leaving the minus lens up for a very long time to prevent any accommodation. Again, are you going in a stepwise manner, and did you record the visual acuity correctly? Meaning, again here, logmar. So if you record 6.6, make sure you've entered the logmar as 0.0 there. And any unnecessary repetitive actions, if you're flustered, don't show it. All of us will be flustered in the exam, but don't show it. Don't tip off the trial frame. Don't drop your lenses. Make sure to be very neat. Put out an act that you have done this multiple times. That helps you to score marks here. And if you've used the lenses correctly, and have you recorded the correct thing you've used? That is something they check. If you've put 3 there and then you think, it can be 2.75, and if you just enter 2.75, they mark you down. They see if you're entering the right value from the trial frame. So that was for part 1, and the OSCE 2, pretty much the same thing, just in a different order, and whether you've asked the red and green. So few tricky things here is the exam center, the screen that they use, the remote control for switching the screens from, you can directly start doing in a logmar chart. You will not be penalized. Or if you want to do in a Snellens and you remember the logmar value, that is also fine. That's also up to you. I prefer to do it on Snellens because I'm very comfortable with it. I just memorize the logmar equivalent for that because I was going to correct to 6.6 or 6.5. So just remember that and you can enter it. That is also a shortcut you can use. You have to know to switch to a duochrome. If you don't know, in the 5 minutes of preparation time before you start this, quickly check the screen of how to go to duochrome. Quickly check how to dim the lights in that room. These are things you can ask the examiner. I would like the lights to be dim. You can be vocal, they will do it for you. Don't be hesitant, because dimming the lights, using the correct chart, using the correct terms are what will score high marks in this, because if you can see, each step contains 2 marks. So if you just pass this exam easily from subjective refraction of sphere. So these are my sources. I used majority of videos from YouTube to practice JCC and this step by step, how to refine it. Once you've done 2-3 straightforward cases, it will be very easy in the exam. So if anybody has any question for subjective refraction, feel free to ask.
Sweta, just a quick question. That was a really nice presentation. I'm happy I did not have to do all that.
I think I was the first batch who had to go into this after a very long time.
Yes, it was. So, any tricks in terms of how to examine the visual acuity quicker? Because I know that would also take a long time.
I started with the 612 line. So I think in the exam, I had this electronic thing where the you get 660 to 624 in one block and then 618 to 612 in a block. So I quickly put the block and I said, are you able to read the last line? And if they said yes, I moved to the next block. I did not make them read from top to bottom and waste time.
Perfect. Yeah, that's what I wanted to ask. Because it's just 5 minutes, right? And
these are like extreme time constraints. So again, while practicing, it is very, very important to have a timer. Make sure to finish your practice timing by 3.5 minutes with getting the final prescription. That makes the biggest difference, I would say, and leave 1.5 minutes for you to enter, because the iPad sometimes is tricky because it's dropped down and you need enough time to check if what you have written is what you've put it. A plus minus will cost you marks.
Could you show us in the iPad the entry for these 2 stations? Because is it much different than?
No,
it's the same. It's the same.
It's the same. It's exactly the same. Just enter. Instead of the cross that you showed, it would just be can just enter the thing, and the next line would be logmar. That's all.
That's it. Okay, fine. All right.
The entry is not very tricky for this. It's just the examiner watches you. The other 3 stations, they are outside. When you're doing the non-cycloplegic refraction, they are inside to see if you're using the appropriate terms with the patient and you're not talking anything to the patient. But it does not connect. The marks are only for the cross and what you enter. The problem with subjective refraction station is the examiner is marking you on each and every step that you do.
Yes, that's true.
So the flair with which you do, it's like an act that you put up. That's the most important part here.
True. As you said, don't mince any words. Just keep repeating it. Even if you feel like it's a repetition, like it's clearer, is it hazier, is it brighter, darker?
Yeah, and to give the right target, use a very repeated letter, use the C's and the O's. And that's very important. I think I lost marks because I just showed the 6.6 line and I said, just focus on the central letter, and I went on. Only when I stepped out of the station did I realize, oh, I did not give the C's or the O's. I still got the 13, but then, yeah, you lose out marks there. These are marks that you can easily get.
Any other questions from anyone?
I think these are the major questions that we get. How to practice for JCC? What is muscle balancing? I think I've explained a lot on this.
I think there are courses as well for these, if I'm right, like physical courses for the refraction exam. If possible, if you guys can go for that, make it happen. But if not, it's not that difficult. You can, it's one of the easiest exams, stress-free exams in terms of preparation. If you've never done retinoscopy, yes, it will be a bit of a longer path before you reach there, but repetition is the key. The more you do, the quicker you'll do and more accurate you become.
I think 100 refractions, retinoscopy too subjective. If you're able to do on 100 eyes before this, the target that you can get, and those 100 should be done in 3.5 minutes with the final prescription.
Yes.
Keep a timer, get an optometrist. So when you're practicing with a model eye, it does not make sense for you to set the refraction and then do the retinoscopy because you already know the answer. So you need a surprise element. So mimic the exam conditions as much as possible. That's the key. So get an optometrist to set the model eye. He or she should not tell you the answer. 3.5 minutes, get the prescription, get them to cross-check it. So when they do it and get the same answer that you got is the point when you say that you're confident in your retinoscopy. So as accurate as possible, and an experienced optometrist who gets the same value as you is your endpoint. And that limit of 3.5 minutes in your mind. So you have enough time to enter it on the iPad, cross-check and relax and make sure that you got the marks. So I think these are the things we're telling from personal experience. That's how I was trained by Shruti for this.
You went above and beyond with the JCC. So
Yeah.
That's,
I think I refracted for around 10-15 people with JCC till I was confident. So that's what you do. Get people with known cylinder and arrive at their axis and just change the cylinder and arrive at their axis and power cylinder number. And then you'll be very confident with JCC. 10 to 15 patients you practice on, you'll be fine.
Yes, I think so.
So I think if you ask about the preparation, this is also one of the more common questions they ask. From personal experience, I think I practiced for 5 days in a row and 6th day gave the exam. So, and I have not done many retinoscopies in the past, or probably I done it 4 years before I give the exam. So it really does not matter. If you put in the time and get it done. So the end point is what matters. If you're able to do it in 3.5, then yes, you're ready for the exam.
True. But take every small point into advice, because these have all been, some of the points were given to me by people who did the exams before, and I passed it on to Sweta, and now she's added on more to those points. Every single thing is important in terms of passing the exam, only because of the time restriction. If the time restriction is not there, like in our residency where we did probably sat there for half an hour doing the retinoscopy, then that is different. But if not, in this situation, note down all those points. I would say, rather than everything else, you would learn the technique. Technique is not the big hindrance here. It's just the time.
Time.
Yeah. So if no other questions, then we had a question there.
Is this for all stations on the website?
Yes.
Yes, we had shown, I think, for all the stations. Like for the first 3 stations, Shruti had put up, it was 12 plus 1 plus 2, where you get 12 marks for the cross, 1 for the distance correction, and 2 for the final prescription. And I had shown you the marking for the subjective refraction stations, those marks, but the exact split is not given on the website. That was from my mark sheet that I took a screenshot of the feedback and I've shared with you. I think that's the only extra thing I could do for the webinar. So the information I did not have when I went for the exam, so I shared it with you guys.
Ma'am, how do you actually use the model eye? So like the sphere can be set with the model eye and then you have to add a cylinder lens? Or
Yes.
does it?
Yeah.
Okay.
So what I used to do is, Sweta was telling you, have another person to do it, but I used to practice alone. So I will just randomly twist the sphere. I won't look at what it is in the back. And even the cylinder, I won't look at what I'm picking. I don't know if it's a plus or a minus. I'll just randomly pick, flip it, and just drop it on the front part of the model eye and just spin it off. That's it. So I don't know what axis is it, what power it is, and what sphere it is. So I try to do it that way. But if you have someone to set it up, well and good, that also helps. Yeah.
It's weird we both practice in the same place.
In a
I
very,
had
very different
VIP
way.
treatment.
No, Shweta, actually, I had come to the UK to find out the details because no one at that point knew much. It was changing. The pattern was changing. It was COVID time. So I couldn't really get much details. So I thought, okay, fine, let's just make a trip to UK, find out all the details. And so 4C meter, coming back to that, you don't be afraid if you've never held a 4C meter before in your life. The first time I saw a 4C meter was in the exam center.
Me too. I had never seen
Yeah.
a meter, and I saw it on the day of exam in the morning.
Exactly.
It just took 5 minutes to learn.
It took hardly 5 minutes and I scored 14. Yeah, Prism I couldn't really, because the problem with prisms is, yeah, you need to know the exact center of the lens to be able to identify the prism. So this could be the center, that could be the center. If you're off by even 1 or 2, 3 millimeters, it's a normal lens is going to act as a prism. So don't be too bothered by it. Yeah.
It's just 1 mark, so just you can just ballpark it and mark it, and then it's a hit or miss. You might get that 1 mark, not get the 1 mark. Don't stress yourself on the prism.
True.
So, and you can always learn 4C meter on the day of exam. Just go through the steps in your head, and that is more than enough. Any other questions? Feel free to ask or just drop a message on the box.
Or even later on WhatsApp if you want anything, whichever works. Yes. All right.
I guess that we can call it a day. So again, reiterating, after this refraction certificate, you can take it anytime. You can start with this, like I started with this, I gave the theory and everything later. But this is very important before you sit the orals. And if any of you is giving this and then proceeding on to orals, we are launching our course in September for the oral exam. It contains 4 sessions of small group teaching, and after that, 2 one-on-one mocks. You can register for just the mocks if you wish to, and or just the small group teaching if you wish to. That's up to you. Thank you for coming today and on a Sunday afternoon. What about work opportunity? Could you elaborate on that question, please? Are you asking about working in the UK?
Yep, I think that's so we'll wind off then. Thank you.
No, they're asking about the work opportunities in UK on the chat box.
Oh, so I did not see that. Sorry. Okay. Work opportunities.
That's just, way beyond the scope of this session, but work opportunities, you need a GMC registration either from FRCS Glasgow examinations or FRCOphth examinations. If you're planning to do it for a short term and go back to your country, then FRCS Glasgow is enough. But if you're planning to continue your career path in the UK, work yourself up to be a consultant here, then FRCOphth is compulsory to become a consultant in the UK. The entry point, we do not have ST3 level or registrar level entry point at the moment. So your entry point would be as a fellow, or it would be as a specialty doctor.
Or a locum doctor.
Locum doctor. Shruti and I both have entered as specialty doctors. I just started, I'm 3 months old, and I think she's a year old in the UK. So,
I mean, the opportunities are there, but if you're planning now with the exams, I would say start building up your CV as well, because your CV needs to stand out in terms with the rest of them. So it is a cumulative thing. So any application, it will be like audits, research, publications, presentations. It's a holistic thing. So it doesn't matter if you're just only good. So they don't really care just about your clinical skills. It also needs to be other stuff. So if you're just starting on the FRCOphth or FRCS path, start building up the CV in other ways. But if it's just for short term, you just want to experience this, there are locum agencies which also hire and, for a fixed contract. Main advantage of specialty contracts is permanent contracts. So that's a different one. Fellows, again, it's a fixed contract. If you're just thinking of coming here for a year and finishing fellowship and going on, it's there. But it's not too bad at the moment, but they are planning to increase their own undergrad seats in the UK and giving more importance to their trainees. So down the lane, how it's going to change is something of a big question mark. So we'll see how that goes.
But your entry point would be as a specialty doctor or a fellow or a locum doctor.
Locum,
and you definitely need to finish the exams to get the GMC for that. Okay, if there are no more questions, we'll wind up now. But any questions regarding practice for refraction certificate, just drop a message on the group. We'll get back to you as soon as. Thank you for attending today on Sunday afternoon, late evening, whichever part of the world you are. See you guys. Bye.
Thank you, everyone. Good evening. Bye.